The world is not only in the grip of a potentially lethal killer with COVID-19, but is also witnessing the attendant emergence of a mental health crisis of unprecedented proportions. We don't yet fully understand the toll of the pandemic, but we recognize there will be significant, long-lasting, and heart-rending mental health reverberations. Today, we're seeing dramatic spikes in rates of anxiety and depression among those who didn't previously have a diagnosed mental health condition, along with seeing worsening of symptoms and relapse in people with serious mental illnesses like bipolar disorder or major depressive disorder or schizophrenia. Mental health professionals are preparing for soaring rates of post-traumatic stress syndrome among first responders and others directly impacted by loss or illness. It's becoming abundantly clear that we need to act to flatten the mental illness curve resulting from the pandemic before it reaches unfathomable proportions. As the only global company solely focused on supporting people impacted by brain diseases, Lundbeck is well prepared to lead through the challenges ahead. Lundbeck's nearly 6,000 dedicated colleagues across the globe are driven by our purpose of being tirelessly dedicated to restoring brain health, so every person can be their best. Central to our commitment is providing education for healthcare professionals via the Lundbeck Institute, as well as through the Progress in Mind Resource Center to provide support for their dedicated efforts to help patients be their best. The Progress in Mind Resource Center has gathered a panel of international experts in psychiatry from the US and Canada, Italy, Australia, and China, where they provide their expertise in mental health and discuss the immediate as well as the long-term impact of the COVID-19 pandemic on mental health in society. These experts will also talk about how the provision of healthcare has and must continue to adapt for the future. We sincerely hope that you will both enjoy and benefit from their wisdom as they go through these presentations. Thank you.
We are very pleased to welcome you to this panel discussion on the mental health impact of the COVID-19 pandemic, and to talk about the learnings that we may have to bring into the future in order to shape the future mental health system. So we are very pleased to have with us panelists from 5 time zones and 4 continents. We have Professor Ji Li, who is the president of Wuhan Mental Health Center in China. We have Dr. Greg Mattingly, who is associate professor at Washington University in the US. We have Professor Andrea Fagiolini from the Division of Psychiatry, University of Siena, School of Medicine in Italy. We have Professor Jean Malley, who is Professor of Psychiatry at the Sydney Medical School in Australia. And we have finally Professor Roger McIntyre, who is Professor of Psychiatry and Pharmacology at the University of Toronto in Canada. Welcome and thank you all for being with us. My name is Linus Jönsson. I am the head of the Lundbeck Institute and associate professor at the Karolinska Institute in Stockholm. The United Nations recently published a policy brief on the mental health impact of the COVID-19 pandemic. This can be described as having several phases or waves. In the first wave, the people who are directly affected by coronavirus infection have a period of acute care followed by a convalescence and rehabilitation phase, which can also be quite extensive. And this can, of course, lead to mental health comorbidity both for the affected patients and, of course, a lot of stress for their loved ones as well. And this could be seen as the first wave of mental health impact from the pandemic. The second wave comes from the effect of lockdown and quarantine policies. This, of course, affects a much wider range of people across our society. In particular, vulnerable groups that are very much dependent on support network already might be at high risk of developing mental health issues because of these because of the isolation and situation with these policies. And that can be seen as a second wave of mental health impact. The third wave comes from a sort of crowding out of ordinary healthcare services as the healthcare systems are being reset to deal with coronavirus infection cases. In some cases, this can lead to reduced access to acute care, but perhaps more importantly, lower access to services for chronic care as well. And this could be perhaps a result in a type of a two-wave effect where we see an immediate impact and then also a longer-term increase in both the somatic ill health as well as mental health issues. And of course, mental health care services are also affected by this and crowded out by coronavirus needs. The fourth and final stage here can be the effects of the economic impact of the pandemic, leading to insecurity around income loss, employment, as well as overall anxiety about the situation, which affects, of course, all of us. So this really affects the whole of society. I'd like to turn first to Professor Yi Li. If you would care to describe to us what is the situation currently in Wuhan? What is the situation you're seeing and in terms of mental health impact, and what are you currently doing to meet the situation? Thank you.
I'm very glad to be invited to attend this event. I focus on the three questions. The pandemic from Wuhan, it began in general this year. Till now, the Wuhan city is entering a new, new situation of the pandemic. We are about 1 month, more than 1 month, we have no new cases of the pandemic of the COVID-19. So till now, almost the whole citizen, the citizens of the Wuhan city is back to the work, try to back normal life. Even though the COVID-19 pandemic caused a lot of trouble to the citizens because the pandemic began from the January this year, is caused more than 3,000 citizens lost their life, and there's the whole medical system almost collapsed during the peak of the pandemic. All of this kind of in one hand, the pandemic stressed the medical staff on the front line, and on the other hand, the whole city was locked down from the January 23rd and lasting for more than 2 months. The lockdown caused a huge trouble, huge stress to the whole community, the whole cities. And so during the shutdown of the cities, all the communities was closed. Nobody in, nobody out. During the lockdown, even nobody can be seen on the street in the city. So this in mental health, in the term of mental health, all of this how to say should be shocked all the citizens living in Wuhan city. This is the background of the pandemic. And how to we what kind of measures of the coping methods to deal with this situation is during the peak of the pandemic, all the so many medical staff is come from the different kind of cities in China to help Wuhan to overcome or to combat against the COVID-19, including the mental, including the psychiatrist and psychologist to help us to set up the system, the psychological systems, and how to say to deliver the mental help to the citizens in communities, and during we do how to deal with details is including is the whole country's the psychiatrist or psychologists to do lecturing to online to deliver to all the country to help the citizens to understand what kind of stress, what's the stress, what's the consequence of that stress, what's the damage, what's the pandemic we cause, what kind of psychological problem we always suffered. So, and this is the first one. Second one is the targeting the high risk people to how to say to screen the symptoms of the disorders, this kind of disorders, and then deliver the individuals service to them. And the third level is to how to say to help or persuade the government to build up the psychological or mental health system for the future to cope with the possible another disaster or the accident to cope with this kind of disasters. That's it. The situation happening in Wuhan city.
Thank you very much. Maybe I could ask Professor Mattingly to comment and to describe the situation currently in your region. We hear reports from the United States that currently the number of new cases, contrary to the situation currently in Wuhan, in the US, the number of new cases is very high at the moment. And any reflections on, are you seeing the same type of impact on the mental health side, and what are you currently doing to meet the situation?
So certainly. So here in the United States, originally we started out fairly fortunate, except for several hotspots such as New York or places like that. My home state of Missouri, which sits right in the very center of the country, we initially had a very low viral load, a pretty low case count. That has started to rise. And I think for a lot of my patients, it's the unpredictable nature. It's the unpredictable nature. We can always deal with our emotions if we can kind of predict the outcome. But in this case, there's a feeling of loss of control. The numbers are good this week, but what if they're bad next week? My children weren't able to go to school this spring, but will they be able to go to school in the fall? So I think a lot of the stress I'm seeing with patients is around the stress, the physical stress, the emotional stress, the social and emotional distancing that we've all had to engage in, but it's the unpredictable nature. And I know even for physicians here in our community, the unpredictable nature of, will my practice be back to normal in the fall? How long will my practice be physically closed down and isolated? How long can I maintain my staff and keep them employed? We've had massive layoffs, not just in the industrial sector, but we've had massive layoffs in the healthcare sector here in the United States because outpatient surgeries, elective medical procedures, the case count is down dramatically. And one of the studies here in the United States said that 65% of medical practices, their income is down by 50% or more right now.
Thank you. So if I could turn to Professor Fagiolini, you've I suppose had experience with the pandemic for a bit longer now, and could you perhaps reflect on the current situation and maybe a little bit around how have you changed the way that you assess and monitor patients in the current situation?
Well, yes, here we have seen basically all the waves that you were describing before. At the beginning, during the hyperacute phase, our patients actually did quite well because we didn't see an increase in the number of crises. As a matter of fact, it seemed that the lockdown was kind of beneficial because they would stay at home, they would have less stimulation, they would have more support from their family members that stayed at home with them. And as a matter of fact, we didn't see any worsening in the situation of mental health. But immediately after, once the lockdown started to decrease, once people had to restart going out, we started seeing much more problems than before. Problems with our patients that increased the number of depression, number of anxiety disorders. Actually, we've seen an increase in the number of suicide, and problems with the general population because nowadays, I mean, in these days, luckily, we don't have many cases. Yesterday, in the entire country, we are about 50 million, so we had 175 cases. Most of them are in the north of Italy, even if we have some region like ours that still have just a few cases every day. But now we are seeing two different situations. One situation is of the people that don't want to go back to work, don't want to go out of the environment where they were. And another thing is for people that neglect the fact that there is the illness and are taking lots of risks. And the third thing is our patients that unfortunately are already feeling the effects of this long-lasting stress. At the beginning, they were able to cope. Now it's 3-4 months, and many of them are getting severely depressed. Many of them have seen what Professor Mattingly was saying, the risk of losing their jobs if they're working, the risk of losing their business. And so the economic impact is starting to hit on our patients as long as this situation of uncertainty that unfortunately is still continuing.
Yes, so is that something you see mostly in your existing patient population, or do you also see new cases? Do you see an increasing number of new patients in your wards as well, as in addition to the increased issues with the patients that already have?
Yes, most definitely. We see many more patients, not all of them with very severe symptoms, but for instance, an extremely high number of people are asking for help for insomnia. Insomnia has increased dramatically, especially late insomnia, people waking up at 3-4 a.m. and being unable to fall asleep again. I mean, it seems that the prevalence, at least here in Italy, has dramatically surged. And then there are patients, people with anxiety disorder, and then there are people complaining, general insatisfaction, general worry, dramatic decrease in the quality of life, even in people that do not meet yet the threshold for a mental illness. And then we see new cases of depression, some cases of PTSD, especially among relatives of people that have lost close family members without being able to say goodbye to them. We're seeing many of these people that are developing PTSD-like symptoms.
I very much agree with your comment about the increased risk of suicide. And I know Roger has written several very timely pieces looking at the impact of stress, economic uncertainty, and what that may do with suicide. But here in the United States, as this stress has gone on, we've seen within our own clinical practice and within our community, people you would not have thought of being high risk for suicide in the past. I just saw a patient yesterday who was found out in her garden after an overdose. Would not have predicted that this would be someone decompensated, but the chronic, unpredictable nature of this stress, I think you're right, it's causing insomnia, anxiety, secondary depressions. And maybe Roger could comment on what we may want to think about as far as suicide rates and cautions that we want to take into account with this.
I'd be happy to, and this segues very, very nicely into what I've been seeing here as well. I refer to this time as the triple threat. The threat of the virus, the anxiety, the uncertainty, the unpredictability. The second is the economic and unemployment security, and the third is the hazard of social distance and quarantine. All three are hazards to brain health. And Oxfam completed a study that included Canada, published last week. 76% of Canadians reporting clinical significant levels of depression and anxiety. And to make matters worse, there's already been a difficult supply chain in Canada with providing psychiatric medications. So it's been a very dire situation. The transmissibility of the virus in this country is less than 1.0. Notwithstanding, the whole country's been really shut down. 80% of all deaths due to coronavirus in Canada, 80% are in nursing homes. So that's a very separate, overlapping but separate conversation. Inspired by this incredible shock, this incredible hazard posed by this anxiety, by this insecurity, and by this social distancing, and also in part informed by what we learned during SARS. SARS affected Toronto more than any other city outside of Asia back in 2003, and I saw firsthand, and we did studies looking at the effect on mental health, and so we decided we were going to do a couple of different actuarial and sort of projection analysis looking at suicide both in Canada and the United States. And we've projected out based on assumptions. Well, it's hard to imagine those assumptions have actually happened. 15 years of job growth were destroyed in Canada and the United States actually in 30 days. 15 years of jobs destroyed in 30 days. And this is affecting many of my patients whose livelihood's been destroyed. They're extremely stressed. They're frustrated by the political action of this country and what's taken place, and the focus only on viral and physical health at the expense of mental health. And so there's a lot of frustration, a lot of anger, a lot of anxiety. Patients, I get emails endlessly from patients about these issues. But just to sort of give you a statistic, what we learned from the Great Recession is what I call the 1% rule. And that is, after the Great Recession, Canada, the United States, and Japan, for every 1% increase in unemployment, there was a 1% commensurate increase in suicide. We used a variety of parameters in this projection that we did both in the United States and Canada. And yes, we are projecting a higher rate of suicide. We have a number of different numbers around that. US has about 48,000, 50,000 suicides a year. Canada has about 4,000. And so we were actually projecting out a very similar rise in suicide that we saw during the Great Recession after adjusting for a whole variety of factors. So, we talk about flattening the curve. That's an incomplete sentence. It's flattening the curve and preventing the curve of suicide and mental illness. And what's really concerning is that the access to mental health care in Canada has been very poor at the best of times. We have a discoordinated system. And what's happened is primary care is effectively shut down, which is the primary way that people are referred to psychiatrists here. And so it's a very concerning situation. So we've got this incredible hazard. We've got an economic situation that's unthinkable right now. People are so socially isolated. And then we have, in fact, this terrible, unpredictable stress, and they can't get access to healthcare. So what we're doing about it is we have begun to create, and we have the infrastructure now, virtual healthcare, not just the telehealth we're all talking about, we're all doing. Zoom went from 10 million subscribers in January, now it's over 300 million. What we're doing is creating a virtual medical home where all medical services are co-localized in one click of a mouse. And I hope one of the positive externalities, one of the positive unintended consequences of this total disaster has been that we're going to, at least in all parts of the world, but certainly here, we're going to see a real rethink as to how we're doing healthcare. And I think you're going to, and it's already happening. There's been some good public-private partnerships that started up and some good government will behind it. So it's been a very, very difficult time for our patients.
Thank you. Professor Mali, I'd like to ask you to step in as well and perhaps provide a comment on what you are seeing in Australia at the moment, and if you perhaps what you're doing to face this situation. I mean, we have an increase in the demand for mental health care at the same time as we have difficulties providing the supply for it. So, any thoughts on how to solve this?
So look, I think this is a really interesting and important discussion. Firstly, it's a privilege to be involved in this and also listen firsthand to people who are at the interface of this complex problem worldwide and how it's emanated and developed in different societies in different parts of the world in itself is quite an interesting story. I really liked your curves at the beginning in terms of the various waves that you depicted, showing how the illness perhaps has an impact. And I think what's really interesting hearing Greg, Roger, Andrea, and President G. Lee is that the main concern is actually not to do with the illness. It's the sequelae, it's the impact of it. And the impact is what we just talked about, the economic impact, the social isolation, and the consequence of the fear and anxiety surrounding the illness and the lack of resources, because it seems to be drawing resources away from other things that are obviously chronic illnesses that people have in a population and society. And so that's really quite an interesting phenomenon. What I also think, which is quite interesting, we haven't touched on at the moment, is how this illness has been a great leveler. We talk often in mental health because we understand how no one is immune to anxiety or depression, and that mental health and mental illness is a problem that can affect any person at any time in their age. And here we have an illness where genuinely no one is immune. No one is sort of safe from this particular illness. And the consequences and sequelae for society are quite interesting. They're replicating many of the stigmatizing attitudes we see towards mental health problems and mental illness generally. So talked about fear. That's a very common concern amongst the general population about schizophrenia, for example, and psychosis is often viewed with some mystery. The personal fear of losing one's income, the impact it has on social isolation, the moving away from family, the ostracism, that's what actually happens with mental illness as well. People experience that when they get diagnosed and labeled with an illness. So there's a flip side to this. There's a sharing of, for us as mental health professionals and psychiatrists, we've actually got a platform to tell a story which people can now understand. One of the biggest problems is people don't understand depression, don't understand anxiety, don't understand psychosis, because the person looks, inverted commas, exactly the same. And so we can have that same story essentially with coronavirus, because anyone can get it. You can be transmitted without even knowing about it, and you can pick it up and so on. So the narrative is very similar. And I think to me, that's what's happening certainly in Australia. We've been very fortunate in that we've had very, very few cases. The number of cases is really shockingly small compared to the countries you've talked about. So our reaction, we've actually had very severe lockdown, limitations in terms of social distancing and people working from home, etc. And maybe that's why we've contained it. But I also think it's geography, and that we're so remote that the only way people could get here was really by plane or boat, etc. Transmission, once it started taking hold, the ports were shut. So we don't have many people unwell, but we have very many people who are anxious and worried. And so we're seeing the other side of this. We're seeing patients who already have pre-existing conditions have become far worse. And one of the things you showed in your slide, which was the wave 3, which was this access issue, that is a real concern, because now so many resources are being piled into managing COVID, for example. People are worried about other chronic conditions. And that, again, is this constant tug of war we play with mental health provision. We're constantly having to fight to say prevention of anxiety, depression, and psychotic disorders is important. Long-term management of these is important, not in a reactionary way. And so that same tension between what is important here and now and what is important in terms of prevention plays out. So, you know, I'm finding that we're really learning a lot from this particular experience, both directly and indirectly. And just to sort of conclude on sort of my own reflection on this, one of the first publications I wrote way back in '95 was actually a consequence of herpes zoster causing frontal lobe syndrome in a very elderly person. And that was because of its direct effects on the vasculature of the brain. Now, we don't have enough knowledge yet to be able to say to anyone with COVID-19 what the long-term sequelae of this illness are going to be. And I think that is another thing that's underpinning some of the fear, that we don't really understand the mental, direct mental effects this illness will have. What we're concerned about, quite correctly, is obviously the secondary effects, which are going to be very important as well. So I think this is very timely and a very important discussion. And I do like that structure that you have regarding the waves, because I think that identifies very clearly some of the points that Roger summed up, very elegantly in terms of his 3 points. But there's those 4 stages which are really important.